idea of having today's conclave is to let people know as to how awareness can actually make a difference to diabetes. And we have a very good panel out here, a mix between Rotary, the organizers, doctors, as well as the Dean from IIT. Thank you so much for sparing some time to be here.
When I started doing my research, I thought there are too many people working on diabetes, so I decided to stay away from it. But one of my younger colleagues, Dr. Professor Rohit Srivastava, he said, well, other people can work on it, I also can work on it, and he has come up with one of the diabetes strips. So there's a lot of technology that is happening around us, both on the monitoring as well as on the management side.
Diabetes is anything but an urban picture. As a matter of fact, the recent statistics now show that almost close to 40-45% of diabetes which is detected is now lying in the rural areas. Diabetes essentially is a problem which tends to occur because of excessive blood sugar, either ingested, either to a certain extent occurs because of lack of any exercise, also because of the sedentary lifestyle and the stress which is imposed on the person. Unfortunately, it is also to a certain extent genetically controlled. It can occur at any age. You can have little children with diabetes. Type 1 diabetes occurs usually in people who are young, for example. Normally it occurs below the age of teens, while the person, when they grow older, they tend to go into what we call as type 2 diabetes, and of course you get gestational diabetes, which occurs in ladies who are having a baby.
Diabetes can be detected and at least the instances can be controlled, if not, the campaign, when we were going through this campaign, the students came up with, can you really escape diabetes? Not eradicate diabetes, because we were told that eradicating is a much larger challenge, but at least escaping with detection. So what are your thoughts on this entire campaign that Rotary is taking the initiative for this year?
Talking about the diabetes, every year Rotary thinks of a massive health awareness programs. This year we have taken diabetes, thinking that more than 30% of Indian population is affected, and more people will fall in that very category. Now we have 5,000 plus Rotarians, and each and every club will go for the diabetes awareness campaign camps this year. More than 300 camps are being planned, and the idea is twofold. One is to make the people aware that you should go for the checkup of the diabetes, and as Keki was telling, if it is detected early, there are chances that it can be controlled by the diet and the lifestyle management. So they should come for the checkup.
A couple of questions were that there are some tests like HbA1c which tells you a 3-month history of your blood sugar. And supposing you are a diabetic and you're going for a test, should you take your medicines and your insulin before doing the test or not? Specifically for people who are in private jobs and all and don't do a test as part of their medical examination. As a pathologist, can you give us some insights as to these tests that are done and how accurate is the glucometer test? Is the urine sugar good enough for tests or stuff like that?
Thank you, Ravi, for this opportunity to answer these questions. First of all, there is no defined age when you should, mandatorily go for a diabetes test. In the sense, a lot depends upon the family history. If there is a person whose parents are diabetic, he is a candidate who might get diabetes. Chances are 50% higher than a child or an offspring of a couple who are non-diabetic. So in these cases, the earlier they start, maybe at the age of 30, at least every 2 years, go for a blood test and check out whether the sugar levels are rising, they are the same or they are normal.
Coming to your question of why diabetes is a multi-system disease. See, basically diabetes is a disease, as you all know, in which there is increase in the blood sugars. Now this blood sugar reaches every cell of the body, so obviously the entire system is going to get damaged. Somehow people are still in the 21st century, people and even most of the doctors are also very much obsessed with sugars. They feel that just controlling blood sugar should suffice, but it is much beyond that. We should look for other parameters. And coming to the multi-system aspect of it, see, most of us are aware of the eye, heart, kidneys, nerves and all, but I think there are a lot of other things which also need to be paid attention to. Diabetes and liver problems, this is a growing epidemic in India. In fact, every third cirrhotic or every fourth cirrhotic patient in India is diabetic today. And diabetes is fast emerging as one of the problems for increasing liver diseases. Again, we should think of the psychological aspect which patients undergo, which patients of diabetes, especially type 1 diabetics suffer. there are a lot of emotional disturbances, anxiety disorders, psychiatric problems, depression and all. In fact, what I see in my day-to-day practice is that every third patient or every second patient has some sort of psychological disturbances. So it is not only that diabetes is a multi-system disorder which affects the system, but it also affects the psyche. So this should be thought of.
No one dies of dies. I do not think any death certificate says that this person died of diabetes. The person dies of a heart attack or this or that, lots of other things. It never says person died of diabetes, and that is the biggest dangerous thing, that this person died due to diabetes is not coming out. I mean, it so much affects, as it is being said, so much affects every little organ of the body, and people die of organ failures of all those different organs. The things are happening, and with collaboration only. IIT Bombay has something called a healthcare consortium, which actually puts together a whole bunch of hospitals and IIT Bombay and some research institutes to come up with healthcare related problems and solutions. Quite a few hospitals, and the Bombay Municipal Corporation is also part of this consortium, as is Hinduja Hospital, KEM of course, Tata Memorial and all that. So we are working on these things.
Obviously, we all look up to IIT for a lot of things, and since it's getting such a problem area worldwide, we will definitely keep knocking on your doors. Thank you so much for this really insightful and very frank answer. It's really important for people to know that until and unless you see diabetes on a death certificate, it's not going to really kick you and say, this guy, this is a killer disease. Whereas it's a part of every killer disease today probably.
In the camp which is being conducted, which will be conducted, is it the test being the instantaneous sugar will be tested, or the 3 months sugar will be tested?
So in the camps that the Rotary is conducting, both the tests will be done. There are special camps that IIT is also conducting along with Dr. Pradeep Gadge, in which only the random sugar will be tested. But as far as the Rotary camps are concerned, there will be HbA1c, there will be creatinine also tested, as well as a thorough test along with the random testing that will happen.